Hi, Amanda. Thanks for being here to talk about the visual activity sort with me. Can you briefly introduce yourself and tell me about your area of expertise?
Sure. My name is Amanda Pearl. I am a clinical psychologist at Penn State in the College of Medicine in the Division of Autism and Developmental Disorders. I am a associate professor. I've been in this field for 10 years now, working with individuals with autism, focusing on community participation, specifically adults with autism who are in the transition age from older high school, older adolescents to college age, all the way into their 40s, and trying to help them do more things that they want to do in the community.
Awesome. That sounds right up my alley. How was how has the visual activity sort been useful with the individuals you work with?
It's been incredibly useful. When I first started conceptualizing the work that I do, I looked for something that could help people start to think about the activities that they may want to do more of in their lives. I don't know about you, but when I ask someone, so what do you want to do? What do you want to do in the community? You usually get kind of a blank stare and people don't know where to start. They know they want to do things, but they just don't know what options are. They haven't really thought about those sorts of things. So I was looking for different ways that we could get people to start thinking about options, and really came up against barriers where I couldn't find card sorts or surveys or questionnaires that weren't targeted at older adults or different kind of aspects of people's lives. So really when I found the visual activity sort, it was perfect because it just gave me exactly what I needed, which is the ability to give people all these options of things to look through and really sort them into ideas so that we could get a pile. Then as an interventionist, I could say, okay, here's a group of activities. Here's 20 to 25 activities that are right in that zone of where we want to start working on, and we can start thinking through these. So it was really the perfect sort of thing for me to get.
And what do you like most about the visual activity sort?
I Everyone loves the pictures. Everyone that I that I see that gets it and looks at it and they say, "Wow, these people look like me. They're doing things that I want to do. It looks like real life. It communicates messages very quickly. I mean, there's the tag label of what the activity is." But it kind of can speak to variability around, what those sorts of things may be. On a survey, seeing the word yoga maybe has different connotations, or maybe people don't know quite what that means. But then when they see the picture, they may say, oh, that's what it is. Or you don't have to explain things to people. They can just get instantly what that activity is and then think in their minds, do I like that? Do I not like that? Do I want to do that? Do I not want to do that? And etc.
In addition to the population you work with, what other client bases and health professionals do you think would benefit from using the visual activity sort or having it in their repertoire?
Yeah, yeah. So I've already had people ask me to borrow it in the clinic where I work. Social workers that I work with have asked to borrow it when working with clients individually in their outpatient clinic. I think that it could expand easily to partial hospitalization programs, to inpatient hospitalization programs, to speech and language pathologists. Um, Probably even psychiatrists and medical professionals. Sometimes, it's just having a very quick thing that they can pull off of their shelf and hand to someone, even if they took a subset of the VAS, maybe the ADLs or something like that, where they wanted to kind of look through very quickly and ask people questions. They really like that. It's all about efficiency and getting information communicated to people quickly and getting actionable steps from that, which I think this really scaffolds well.
Thank you so much. That's great feedback. What other comments do you have about the visual activity sort?
I think that um, it's a wonderful uh, uh, product. I can't say enough about it. I think it gives a ton of information out of just very little input from the participant or from the person that you're working with. So even in my research study that we're using it in, we asked them two very brief questions, the motivation question and the interest question, from a subset of the activities. And the amount of information that comes out of that is a lot, and it's wonderful. And when we look at the data on the other side and start uh, conceptualizing people from that data and looking through with it, it really works wonderfully, and it really pairs wonderfully with other sorts of things that you're looking at. Things like anxiety or depression symptoms or autism symptoms, or other community assessments of how much participation someone is engaging in. And you can really weave that together to both look at a picture of how people and where they're at in their lives now, and what some things that you can do, specific actionable kind of treatment goals that you can create from that, which I think is just wonderful.
Thanks so much. I really appreciate that you're using the visual activity sort within your study. And it sounds like you're getting a lot of feedback from your participants that they're enjoying it too. Is that correct?
Yes, yes, for sure. No one, it's probably one of the longer assessments that we have. I mean, because we've chosen to use a lot of the cards because we like a lot of the cards. So I think we use around 120 of them or something like 140. So we use those, but no one has complained, not once, about taking it. I think it's nice, it's quick, gives a lot of information. And when I say to people, in the study, when we're working in the intervention, I say, remember those cards that you looked at? They'll say, oh yeah, 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 I remember those. And they very much, then we start working on them. I say, here's the list of the things that really came out of that it showed that you may want to work on. And it just naturally kind of organically starts the conversation beautifully from there. No one has any difficult. I haven't had anyone have difficulty with it, and I've had a couple people use it that have mild intellectual disabilities, and even with those individuals and people with autism, like I mentioned, and we haven't had any difficulties so far.
Thanks, Amanda, so much for coming here and talking to me about the visual activity sort and including it within your research. I
Sure,
appreciate your time today.
anytime.